periorbital hyperpigmentation, also known as periocular hyperpigmentation, periorbital melanosis, dark circles, infraorbital darkening. These are common conditions that are found in the practice of aesthetic medicine. Pathogeny. Factors causing genetic or hereditary factors, excessive pigmentation, post-inflammatory hyperpigmentation secondary to contact dermatitis, periorbital edema, excessive vascularity, thinning of the skin, shadows due to the laxity of the skin, and depression in the nasonuclear fold associated with aging. Meline dark circles treatment protocol. At first, we are marking of the treatment area. We're cleaning and degreasing the area. With the help of cotton canes, it is proceeded